So I have somebody I just started working with, worked at our office, and they were new in town. They went to a dentist, and first checkup, the dentist, they had some problems, I guess some cavities and such. And he asked the dentist, he said, I didn't have any of these problems before. And my question is, how can that happen? I mean, how can all of a sudden I got a great record, and then I go see another dentist, and it's like...
Not so good, right?
Yeah, not so good.
Okay, this happens to me too, by the way. I'll be at a restaurant. Oh, you're a dentist? Hey, can I ask you a question? Like, well, yeah, sure. As long as it's not going to take the entire time for me, let's go with it. But respectfully, as a dentist, you'd never hear me bashing another doctor's performance or lack of a performance. But we do know that sometimes, like your friend or the guy that you're working with, when someone says, I've been going to a dentist for 20 years and now I'm with a new dentist because I've moved or I've just changed or the other doctor retired, what happens is that maybe at that time there wasn't any problems. And then COVID hit 4 years ago. And so when someone says, I go to the dentist all the time, but we know when we had a closure, there were people that hadn't gone to the dentist for 2 to 3 years following the reopening after the closure. The point I'm trying to make is that right now, today, if your coworker was in my office and I saw gaps in fillings and broken crowns and missing teeth, I would have to say, hey, it looks like your doctor's been taking decent care of you. Have you missed any of your dental appointments? Well, I guess it's been a year and a half.
Okay, gotcha.
But if it wasn't, cavities and fractured fillings and broken teeth can happen within 30 to 60 days. So we've had, people come in, I just had my teeth cleaned. Why do I have this cavity? Well, it's today, this is what we're seeing. I don't know what the other doctor saw. Maybe they didn't have x-rays at that last appointment.
Yeah, okay, right. That's
so
right.
there are a lot of reasons. The real point is that my job, the state of Ohio, I'm licensed as a dentist. I have to tell you my findings. I have to tell you what could happen if you didn't do anything. So the third thing would be, what's the benefit?
Sure, yeah.
And then I would never force you or your friend to do anything, but my question back to you would be, what do you think? So if it's not time for you to do something because you're traveling or the budget is usually what it is.
Sure.
The third or the most important out of that this conversation would be, if you're not going to move forward with any of the dental treatment that I'm suggesting and recommending, at least maintain your dental cleaning appointments. What that means is if you're twice a year, I want to see you 3 times a year.
Okay. Because that way you can keep an eye on stuff and if things progress.
And then if say you do get a little not so good, then we can take care and address that procedure so that we can minimize the extent and the expense. That's it.
Yeah, okay. And that's so, having a practice eye on your mouth is not a bad idea, just even if you're not ready for something.
So always keep your cleanings, and then we'll actually get to the point where we're fixing teeth. It takes the average human being about 5 years with extensive dental work to complete.
Okay.
So provided they don't have any other accidents in between there, but...
So you probably want to get started sooner than later.
Yeah, and well, here's the other fact, too, that you should remember. In our practice, we know this, that the healthiest patients are the ones that take care of it right away. So if it's extensive, they usually do it within 12 months.
Okay.
Not everyone's the same, but that's what I've noticed.
Okay. Well, thank you for filling us in on that.